Welcome to Beyond the Margins. I'm your host, Jason. Today, I've got a very special guest, Dr. Alister with Link Health. That's one of his organizations he's here to tell us about. I know that this is an organization that works with marginalized communities, so I think it's really important all of my viewers get a chance to hear so that they know where they're at and what they can do. Dr. Alister, please tell us everything about Link Health.
Thank you so much for having me on the podcast, Jason. It's incredible to be here with you. The work that we do really sits at the intersection of what we call the health wealth gap and federal and state benefits. Now, for the listeners who are tuning in, you might be asking yourself, what the heck is the health wealth gap? Well, it is what most folks probably already understand to be true, and that is folks who live in poverty in this country, they often suffer from worse health outcomes. They have a higher rate of chronic diseases, they die at an early rate, they have limited access to healthcare. And here's the thing for the listeners that folks might not be aware, but the bottom 50th percentile of our country, you know how much money they live on every single year, Jason? It's $24,000 a year they live on.
Really?
And that is the bottom 50th percentile of our country. And I see these folks every shift that I go to the emergency department. I take care of patients who have Medicaid, which is a form of health insurance. And what we find with Medicaid patients is that the salary is even lower. 87% of patients who are on Medicaid live on $20,000 a year or less. And so at the end of the day, what I see shows up in my emergency room every night is poverty is the real issue that's causing our health wealth gap. Now, what we do at Link Health is very, very, very simple. We've identified there's over 80 billion, that's $80 billion that goes unspent every single year. These are dollars that are pegged to help things like, get you money to pay your internet bill, or money to put nutritious food in your fridge, or money to help cover the cost of rent for a month before you're evicted. And people don't know about these programs. And all we do at Link Health is connect those people to those programs and make it easy for them to get the money that's they're already eligible for.
That's really interesting, Dr. Alister. So I guess I have a few questions. Let me tell you a little bit about my background. I was a respiratory care practitioner in acute care for over 20 years. I did a lot of time in emergency rooms. I've worked at VAs, level 1 traumas. I've done it all.
So tell me you can work a vent.
Yes, sir. Yes, sir. Absolutely. But, I did see, of course I saw, but I wasn't having access to their financial information. But you can tell most of the hospitals I worked in were lower income areas. So I knew what I was seeing when it came in. And as much as the hospitals I worked for did help those people, I guarantee you they never knew about this kind of opportunity. So how did you come across the information in the first place?
Yeah, it's a really, really, really good question. So for the listeners at home, I'm bald, and I was just making the mime of pulling out my hair that I don't have when Jason said they could have benefited by knowing about these programs. And the reality is, yes, my goodness, so many of the patients that I have in front of me in the emergency room, yes, of course, we're going to take care of the knee pain that they've had for 2 months, or the work note they need me to sign, or the prescription they need me to write a refill for because they don't have a primary care doctor. But you know what the real issue is? The real issue is I'm sending that patient home to an empty fridge at home. I'm sending that patient home with their 2 kids where there's no internet, and those babies have to do homework that requires internet. Right? I'm sending that family home to a place where folks are living paycheck to paycheck, and they're having to make decisions between, do I pay for my medication or do I eat? These are the kinds of things that I see in the emergency department. And so how I found out about these programs is I actually took a couple of years off. I left the practice of medicine. I was a 3rd-year medical student at the time. I had it up to here, Jason, with the way that I saw the medical system not working, how broken it was. And I left medicine and I went to a place called the Harvard Kennedy School of Government. And it's a place that teaches you the basics of public policy. And it was there that I was first exposed to what are called public benefits. These are benefits that were approved and passed by Congress. We don't have to fight about it anymore. The money's there. Right. It's at the state level and the federal. We already agreed the money's going to go to SNAP or WIC or rental assistance. The issue is people are not taking advantage of the programs, or the programs are too hard to apply for online. So that's where we come in.
Yeah, I was just having a similar conversation recently about some of the laws that are written, and I don't want to talk about the specific one because I don't want to bring the personal conversation into it. But I feel like there's some things that are passed, like these benefits, and some laws that are passed in the best interests, but they're not taking into account the socioeconomics of some people. You can say that there's these benefits. You can say that there's this law. But if they live somewhere where they don't have TV or internet, and let me tell you, I live in Las Vegas. And some of them don't have internet or computers at home. So you get even under that level of income, how are they getting the information to even know? So I get very frustrated by this because I'm a social justice guy, and the more I learn, the more frustrated I get. But what I'm learning is that people don't even realize, the people that want to do good don't even realize why it's not working. It drives me crazy. Just like you, obviously, it drives me crazy. And I'm so glad to hear that there's a foundation that's working towards fixing that. I just am also going to be concerned, though, that how do we get the word out about you? How do we tell these communities? And as I'm sitting here thinking about it, and where are you located right now?
I currently practice medicine here in Boston, Massachusetts.
Boston. Okay. So I'm thinking to myself, I mean, of course, we will talk about it here and we will put it on the podcast, and it will spread on your social media, my producers, my friends. The word will get out. But the people that don't have internet still can't hear it. So I want to, and I'm going to say it again at the end of the show in case I have to edit around this for some reason. But what I want to do is put a call out to anybody that's watching this. You don't have to go into bad neighborhoods at night to talk to people. You have to go to schools, community centers, hospitals, any place that you feel safe, because unfortunately, our people who don't have the money also have to live in those places we don't want to go. I have worked in those places, and I have had friends in those places. I get it. I know why people don't want to go. I went because I knew people. But I'm going to start doing it. I'm going to start making sure that when I'm in an area that I know is lower income and may not be getting this podcast or other ways of getting this information, I'm going to make sure I start talking to people. Maybe I'll put it on my business cards and I'll give it to them. They need to know. So everybody that watches this, everybody that listens to this, please, when you're in those areas, if you go to those areas, if you have friends that go to those areas, share the podcast with them. Tell them about the benefits, but tell them about places like Link Health where they can go and get help to find those benefits. Dr. Alister, are you available to all the states? Can they find you online and get help wherever they are?
Yeah, it's a really good question. So our website is national, so folks can learn about the different benefit programs and understand how they qualify and things like that. They can go to linkhealth.org. That's LINK dash health, HEALTH.org. So they can learn. Now, we only have an operation in 2 states, and that's Massachusetts and Texas on the ground. So what I just shared is folks can learn about these benefits online, but in person, we only have the resources to really cover Massachusetts and Texas at this point. Hopefully, in the future, we'll be able to cover more. But what I want to share is you're talking, Jason, about the concept of accessibility.
Yes.
So key to this discussion. There's a whole, sort of, mountain of energy that goes into getting these laws, getting these programs on the books, getting these laws passed. But what happens when those laws and those programs are not accessible to the communities that they are meant to serve? And I'll give you a concrete example of that. Back during COVID, I remember I was taking care of an elderly Latino man, and he came in with shortness of breath and cough, and it looked bad. It looked like we were going to have to put him on a ventilator. Jason, back to your world, from your world as a respiratory therapist, we were going to have to put this person on a ventilator. And I remember speaking to him, and I asked him, this was around the time the vaccines came out, and I asked him, "Are you vaccinated?" And he said, "No, unfortunately, I'm not." I said, "Well, did you consider getting vaccinated?" He said, "How do I do that?" And I said, "Well, you go online and you sign up for an appointment on the state website here in Massachusetts. You get an appointment, and you go to the appointment and you get the vaccine." He said, "Doctor, I don't have a computer.
Yeah.
How do I do that?" Right? So it comes back to your point of these resources can be made available, but if they're not made accessible, we're really going to struggle to bridge the gap. And that's where Link Health comes in. We enroll people in these benefits. We go the extra mile. We sit next to that patient. We go and meet people where they're at to get the job done and get folks enrolled.
All right, I'm going to ask you a tough question now. So if people, say in Las Vegas, wanted to help Link Health to spread the word in Las Vegas, say as volunteers, would Link Health be able to help them, maybe not monetarily, but with some kind of guidance on what they can do, how they should do it? Is there any, could they use that? I'm just trying to organize, because I'm thinking to myself, here, this is one of the most compassionate places I've ever lived. And if I could get the message to people that this was really an issue that they could help with, I don't think they would hesitate. I think you would have volunteers coming out of your ears. You wouldn't know what to do with them all. So is there something we could do to maybe collaborate with Link Health if people wanted to bring that message out?
Absolutely. So we have 2 different programs that we're really excited about. The first is our Fellows and Ambassadors program that exists in person in our 2 geographies, in the state of Texas and in Massachusetts. And so if you're in one of those states, we'd love to have you with us in person, helping people do the enrollments right then and there. And we've been very effective. We have over 75 fellows and ambassadors who every single day are helping people access these benefits. And they've been able to help enroll over 2,355 patients in these benefits. They've been able to distribute over $2.4 million in funding.
Wow.
It's incredible what they've been able to do. But the second program is the program that I would offer up to what you've just said here, Jason. It's called the Remote Ambassadors Program. These are folks who are not in those 2 states, but want to help remotely get people enrolled in these benefits. via text message or via computer. So we can assist people not next to them. And so on our website at linkhealth.org, there is a Work With Us tab, and you can find a link to sign up for a shift as a volunteer, which is only a couple of hours, and it's really just getting people enrolled in these programs that they might be eligible for.
That's amazing. I think when we get this word out, I think you're going to be overrun with volunteers. It's such an easy thing to do, and it's such a huge way to help people.
Yep.
I think that when people realize how easy it is and how effective it is, I think that they'll jump at the chance to join as ambassadors, remote or live, really.
Yep. Yep.
Dr. Alister, I would like you to share anything else with us that you'd like to share before we go.
Yeah, the work of Link Health is really just one step, one concrete approach that is out there to help people connect to these benefits. And we've been successful at the beginning of this work. We've helped more than 2,000 people enroll in benefit programs like SNAP, WIC, Lifeline, TANF, and the sum of it is we've helped distribute over $2.4 million in funding. But we're just getting started. And so we need all the help we can get. If folks are interested in volunteering or being involved, please reach us at linkhealth.org.
Amazing. And please send me those links because I'll add them into the description. I just want to say, thank you. I just want to say that I'm so happy that we had you here. It's so eye-opening and really heartwarming to know that somebody's out there. And my experience with physicians is very mixed. I have a lot of them that were very compassionate, but then I'm sure. And then so many that were cold, so we always hear about the cold ones, just like we always heard about the bad respiratory or nurse or whatever. So it's always good to have somebody on the show that we can say, yeah, but look what they can do. Look at what they're doing. They're not just being cold, heartless people. They've got a heart. They just have to hide it sometimes. That's all. I appreciate you. I appreciate everything you do. If you have any updates in the future, please let me know so we can have you back on. I've really enjoyed talking to you. Maybe next time I'll be able to do it without clearing my throat all the time. So viewers, listeners, thank you so much. Please check the description for the links to get you over to Link Health so that you can become an ambassador or get help if you need it. Please remember that everything we do on the show is about bringing people together for unity. We want to change the world, and that's what we're here to do. Other than that, I'm going to say for Dr. Alister and, of course, for me, Jason, your host, have a great night. We are so sorry, and we'll do better. Bye-bye.